My name is Gretchen King, and I'm a resident of Berry City, and I'm here to testify in regards to the budget cuts in mental health, and I'd like to share my story with you. On Wednesday, April 7th, 2010, Justin Paul Gordon, my 20-year-old stepbrother, committed suicide. He shot himself outside the back door of our parents' house. On Sunday, August 29th, 2010, I stood doing the dishes in my pantry. I could hear my two young boys playing together in their bedroom. Earlier that afternoon, we had been at my sister's house. It was a nice afternoon of visiting while our boys played. As I continued on with the dishes, I began to plan. I began to plan how I would actually kill myself. I had never planned before. Thoughts of suicide were nothing new to me. I had thought of committing suicide halfway seriously since I was 17 years old. The thoughts I had that Sunday and the plans I began making were new, and by the grace of God, I did not follow through with those plans. Mercifully, I realized I was not thinking right, and I made the decision at that moment to call my doctor in the morning. I had been on antidepressants for years, but it didn't seem to matter that afternoon. The next day, I called my doctor. Still horrified at the feelings from the day before, I told them I needed to be seen immediately, and I was in their office within an hour with my dad. Over the months since Justin's suicide, I slowly slid into a serious depression. I experienced various other losses during that time, including a friend's suicide a month after Justin died. I started self-medicating with alcohol heavily, and of course this only made matters worse. Looking back, I see so many signs of how I was affecting people in my life, especially my children, and signs of people trying to help me. I met with the doctor. I was given a prescription change and referral for counseling. I'm so grateful my father went with me that day. Of course, he felt compelled to share the news with my siblings. My sister, a mandated reporter, called the screeners at Washington County Mental Health, and my ex-husband. I thank God, my family and friends, and the staff at Washington County Mental Health for me being able to share my story with you today. The fact I'm here publicly sharing my story is testament to what I've learned about myself and what I am worth and capable of, and what the staff at Washington County Mental Health has done to make my life better, let my children have a mother, my siblings have a sister, and my parents not to lose another child. Thank you.
Thank you, Gretchen. Gretchen, what will you just
I didn't hear any Gretchen. Please come and start.
It's Margaret Doyle.
Page of testimony that I won't read today is a letter from a client at Washington County to this committee. My name is Margaret Doyle. I'm Director of Outpatient Services at Washington County. I'm Chair of Adult Outpatient Directors of the Vermont Council of Developmental and Mental Health Services. Last year, adult mental health programs in the state of Vermont saw close to 8,000 people and provided over 64,000 services. 15% of these people were uninsured. That's a 3% increase from last year. I agree with previous testimony that the plans to roll Catamount into VHAP will actually result in an increase in the uninsured. 55% of those people have Medicaid. More than 2/3 of our clients fall below annual salaries of $20,000. At Washington County alone last year, we saw over 1,100 people and provided over 10,000 services. 13% of those people had involvement with correction, 14% had psychotic diagnoses, 20% had co-occurring, and 31% have PTSD. We have a waiting list of over 50 people, so if you consider the testimony you just heard before me, you might want to think about what that means. We have 50 people waiting for services. Over 15% of them have no access to any other care because they have no insurance. It's the longest waiting list I've had in my tenure of my entire employment at Washington County. Our clinicians see between 60 and 70 clients a year, providing over 700 services. If we sustain a 5% cut in outpatient services, we will lay off staff. For every person laid off, 60 or more clients will be added to that waiting list. Last year, the cuts resulted in an increase, a 30% increase in mobile crisis and support calls. The recommendation to roll Catamount into VHAP constitutes a significant increase in reimbursement for private practitioners. The result of that will be an increased demand for outpatient services in the VA system, and we will be ill-prepared to meet this demand if we have fewer staff. There are exciting initiatives afoot these days, Blueprint for Health, SFI. If we don't have the capacity to meet those needs, we won't be successful. I know I'm over, but I just want to say this to you. Do you all own a home? You own a home? Because I do. Ice dams, leaking roofs, the need for upgrades every year, or the value of the home deteriorates. You let it go long enough, the home becomes unstable and dangerous to the people who live in it. That really is where we are today. So I'd ask you to think about it. Thanks.
Waterson.
Good afternoon. My name is Erin Waterson. I'm from the Vermont Network Against Domestic and Sexual Violence, and I'd like to speak about funding for housing. I want to start by thanking you for including $500,000 for homeless services in the Budget Adjustment Act. A portion of this funding should help to prevent survivors of domestic and sexual violence from becoming homeless in the coming months. We all know that there is a housing crisis in Vermont. Domestic violence advocates work day in and day out to support survivors' access to safe and affordable housing. From October 1st through December 31st of 2010, our member programs throughout the state kept an informal count of housing supports for victims and survivors in order that we might collect a broader statewide picture of the challenges facing victims who are seeking housing. Our results reflect all but one county in Vermont and include 445 adults and 382 children who required assistance with housing when seeking our services. Out of the 445 adults seeking housing supports, we know that roughly 32% of them received GA funding. We also know that approximately 5% were denied GA funds. Of all these people reaching out for support, only 28 were able to move on to transitional housing or new apartments. 28%, excuse me. 31% found options in which they were more precariously housed, such as staying with friends or family. And a full 10% either stayed or returned to their abuser for lack of housing options. These informal numbers confirm what we've been hearing for years. Many survivors of domestic and sexual violence rely on state supports to access safe, affordable housing, and many survivors, the existing services for them are inadequate. For this reason, we urge you to support the governor's budget recommendations to level fund member programs of the network and to fund the general assistance housing supports at a level sufficient to replace the federal HPRP funding that has filled in GA gaps for the past 2 years. Thank you.
Thanks, Anthony. Barbara Prime. Is Barbara Prime here?
I gave you a new one.
Rebecca Bryan.
Madam Chair, I'm going to pass. My colleagues are part and cancer and covered on camera.
Okay, thanks, Rebecca. Lee Lauber.
Good afternoon. I'm Lee Lauber. I'm the director of the Family Center of Washington County, the Parent-Child Center here in Central Vermont. And I'm here today representing VACRA, the Vermont Association of Child Care Resource and Referral Agencies, which is a statewide network of local agencies in each one of your districts. And what I'm here today is to give you an update about something that was under discussion last year, the centralization of child care eligibility determination. Last year, you took an active interest in that issue, especially Representative Heath and Representative Miller were helpful in getting language added to the FY11 appropriations bill, which interrupted the plan to centralize that eligibility determination early in this fiscal year. You've already heard from DCF Commissioner Iacoboni that he did not move forward to centralize eligibility on February 1st of this year. From our perspective, that is a very good thing. There was a strong coalition of state and local entities, including Voices for Vermont's Children, the VACRA, the Vermont Parent-Child Center Network, Mama Says, which is a parent advocacy organization, Early Educators United, the Vermont Association for the Education of Young Children, and the Shumlin administration, who felt that it was premature to move forward with that centralization. And we certainly agree that it was premature. The handout that I just passed around to you is a summary of what has happened since the administration decided to assess what the actual impact would be of centralizing. That was never done last year when the first proposal was made to you. So we have people who are working from the community and from DCF to develop models of possible solutions. We agree with Commissioner Iacoboni that keeping community support in place for families and providers who are involved with child care financial assistance is a positive thing. And I would be happy to answer more questions at another time. Thank you.
Erin Chestnut.
Hi, my name is Erin Chestnut. I am a student at Johnson State College and also a board member for NFI, which is Northeastern Family Institute. And I would just like to mention how important NFI is to kids in Vermont, in New England, and it was really important for me because I grew up going from different foster homes, and NFI was sort of where I found the base. And I went through a lot before I went there. I met my 15th foster mom, which was really important because she was a part of NFI, she worked there, she was a foster parent, and I was not really into meeting new people, and she is now going to adopt me. She's my mom, she's everything, and I think that this is an opportunity that everyone should have, and everyone should be able to find their root and find their base and have this opportunity. And without NFI and without the proper funding and the proper base for their company to exist, these kids don't have a chance. And without them, I wouldn't have a chance. I'm a sophomore at Johnson State College. I'm a psychology major. I'm now part of the NFI board of directors, and I've got a good future, and I wouldn't have that without NFI. And so I want these kids to have the same chance that I did, and I think that it would be very important for them too. And these kids are our future. They're your future, they're my future, they're the future of the state. So, thank you.
So that's the last person that we had signed up to testify. All right. We have Joseph
Gaines. Hi, my name is Joseph Gaines. I live in Marshfield, Vermont, and I don't represent a particular agency. I'm just a citizen and a taxpayer, and I want to thank you all for the service to the state. You know, our state motto is freedom and unity, and I think we need to be paying attention to that as Vermonters who love our state. We're being told that everybody has to tighten their belts, that we all have to make sacrifices in these hard times, and that's true. I don't envy your work, and I thank you again for doing it. But there's a particular group of people in the state who are not being asked to tighten their belt, who are doing very, very well, who just had a tax break from the federal government. For the top 5% of the wealthiest Vermonters, that tax break amounted to $190 million. I think those Vermonters care about the state as much as any of us do, and I think it's time for us to be looking at revenue enhancement by asking these people to take a little smaller tax break, not to take away their entire tax break, but to take a little smaller tax break and start putting the money into human services. A $44 million budget cut in human services in this state will really devastate, as these wonderful people have been telling us, will really devastate our neighbors. And there's another issue involved. If this is unity, if we're all being asked to tighten our belts, then all of us have to. The failure to have our wealthiest Vermonters contribute to the well-being of their neighbors begins to fracture that unity. And I think it's time we bite the bullet and do the politically unpopular thing, but the right thing to do. And that's to ask the wealthy to pay their share. Thank you.
Thank you, Jim. Renee Carpenter.